Can we always do what we want with our bodies or property? Maybe, maybe not. To answer this question, we have to first define the principle of respect for autonomy and then what it means for a choice to be autonomous. So let's start by defining the principle of respect for autonomy. We normally think that we can run our lives the way we want to. If you want to go to the bar, attend church, or play sports with your friends, we typically think that it would be morally wrong for others to stop you from doing so. What's lurking in the background of this common moral judgment is the principle of respect for autonomy, which states that we have a moral obligation to acknowledge the right of other agents to autonomously choose and act on values and beliefs so long as those actions do not harm others. But that's just the beginning. There are actually two types of moral obligations here, which we can break up relatively neatly into the categories of negative and positive moral obligations to respect autonomous choice. A negative obligation or duty to respect another's autonomy means that others shouldn't restrict her from pursuing her goals. This is the type of moral obligation I used in the earlier examples, where I said it would be wrong of others to stop you from going to the church, bar, or basketball court. However, there are also times when we have a positive obligation to respect another's autonomous choice. This positive obligation is an obligation to do more than merely let people pursue their goals. It is the moral requirement that we ought to enable others to achieve those goals. For instance, a clinician often has a positive obligation to equip the patient with the information necessary to make an informed decision concerning a procedure. By doing this, she helps the patient achieve the goals she has autonomously set out to achieve. But in order to fully understand the principle, we need to define what it means for a choice to be autonomous. An intentional choice is autonomous to the degree that 1. One understands the action she will perform, and 2. That action is free from external influences. We may also want to include internal influences, such as mental health, as factors that affect autonomy, but for the sake of this video, I'll set that complicating factor aside. Notice that these two factors that affect autonomous action come in degrees. Take, for instance, the understanding factor. If someone lacks or has a lower degree of decision-making competence, their decisions will be non-autonomous or at least less autonomous. Now, there's no hard and fast rule for factors that precisely determine one's degree of decision-making competence, but there are 3 really important factors that are relevant. Generally, someone has diminished decision-making competence when 1. They are unable to express or communicate a preference or choice. Such individuals include patients who are in comas. 2. They do not understand their situation, relevant information, and/or the foreseeable consequences of their choices. An example of this important autonomy affecting factor can be seen in Bang v. Miller Hospital, 1958. In this case, Bang did not know that prostate surgery would result in sterilization. As a result, he did not have an adequate understanding of his situation due to his lack of relevant information to make an autonomous choice. Or 3, they are less capable of providing a reason, rational or otherwise, for a decision that evidences careful consideration of relevant decision-making factors such as the costs and benefits of action. For instance, children are less autonomous because they are usually unable to make decisions that carefully and thoroughly address information relevant to a particular choice. Just meet a child, you will see this is true. Those are at least a couple of the ways that one might have diminished decision-making competence and, as a result, act with less autonomy. Let's consider the second factor that affects the degree to which one's choice is autonomous: freedom from external influences. There are a variety of external influences that might affect the degree to which a choice is autonomous. But here, I'll just focus on 2: coercion and manipulation. Let's start with coercion. One coerces another to perform some action just in case she presents a credible and severe threat of harm or force to control another. For instance, you would be coerced into giving your money to a stranger if she threatened to do something terrible to you. But not all coercion is morally impermissible. For instance, law enforcement can justifiably coerce, through force or the threat of force, a criminal to make sure that the innocent civilians are safe from the criminal's activities. A second way one might interfere with an agent's autonomous actions is through manipulation. One manipulates another just in case she attempts to influence another's action by bypassing that person's rational faculties. So, manipulation occurs when a clinician misleads the patient by dangerously exaggerating the success of some treatment. But again, not all manipulation is bad. For instance, nudging a patient to choose a particular option by ordering her options in a particular way may be morally permissible if there are significant benefits of one treatment over the other.
So there you have it. We have a moral obligation to respect another's autonomous choice so long as that choice does not harm others.
And one's choice is autonomous to the degree that she understands what she's doing and is free from external influences.
Thank you for watching.